this clinic is possible only because of partnership. Partnership is the very nature of the care being given. It was many of us, you all who do the important work here, your colleagues, us in Baltimore, we all saw a tremendous need among patients here in Prince George's County. Patients who were transitioning out of hospital care and who ran the risk of being ultimately readmitted because they had no safety net protecting them, no team who understood their unique challenges and how to manage them. We saw this need, we collectively, but that's not all we saw. We did see a path forward together, a better way to care for this community, a better way to connect patients with the primary caregivers they need, a way to assemble around these patients who are often so affected by the social determinants of health, a way to assemble around these patients a team of professionals who can integrate the kind of treatment and services that truly promote health and well-being.
Whenever we have the opportunity to address population health along with disparities in healthcare, it points directly to our mission here within our healthcare system. Having the Interprofessional Care Transition Clinic here at Prince George's Hospital Center is clearly an honor.
I certainly want to build on this conversation of partnership. The University of Maryland Medical System's a very large health system now spanning the state with 14 hospitals. And of course, our newest affiliates is our University of Maryland Capital Region Health, and we are so proud of this partnership. And when you get the University of Maryland Medical System, you get the University of Maryland Baltimore, and they won't blow their horn this morning, but I'll blow for the deans and Dr. Perman. I'll blow it for them. This is a first-class academic group of folks, and they understand what multidisciplinary care is. They understand what partnership is, and they understand what teamwork is all about. And that's what's ultimately going to make for success, not only in this clinic, but in the greater delivery system here in Prince George's County, is how well we can collectively work together and leverage the huge assets of our organizations.
The affiliation with the University of Maryland Medical System, the School of Medicine, the professional schools has really been great. We've gotten that done now, and so that solved theme number one. Here come the resources, and it comes this time in the form of the ICTC. But by adding this resource, we're also simultaneously addressing the other three recurrent themes that I heard throughout my early days, and that was primary care providers, a teaching program that would address the social determinants of health, and a team of what I will call social determinant destroyers that's comprised of nurse practitioners, pharmacists, social workers, and really importantly, lawyers, that hopefully as the program evolves, will bring in folks that will train here, serve here, and hopefully stay here.
I want to tell you the story through one patient's experience. Mary is 67 years old. She's known to us and been treated in our emergency department and hospitalized at Prince George's Hospital more than once. After a hospital visit, Mary came to the Family Health and Wellness Center, right where you are, to the practice for a single visit after discharge. But she couldn't seem to get into a routine to establish a relationship with a primary care physician after her hospital discharge. After chest pain that required yet another hospitalization, the ICTC team, the social determinant destroyers, connected with Mary, and they built a trusting relationship. And it's amazing to think about the rapport that could be created by this team. They created this rapport. Mary revealed to the team, these things don't come easy. She revealed to the team that she had social and financial concerns that impacted her ability to pay for her medications, and these medications were many and they were complex, and that she was about to become homeless. The ICTC team helped Mary manage her social, housing, and medication issues, debriefed the doc regarding the patient's concerns, and scheduled her follow-up visit. Since the initial ICT encounter in July, Mary's connected with a family medicine doctor right here on the 3rd floor of this very building, and she's had her 2 follow-up visits routinely scheduled. She's doing well and has had no additional ER or inpatient visits. This is fulfilling the mission of the ICTC.
As you heard, as you know, that despite having insurance, many Medicare and Medicaid patients in this county still are in need for medical care. They're still in need for primary care providers. We know that health disparities exist in spite of all of our efforts. So imagine you being hospitalized, in Prince George's Hospital Center in the emergency room, being discharged, and having the opportunity to be seen by interprofessional team, having the opportunity to have this team all together in one room, assessing all your needs and developing an interprofessional plan, assisting you if you don't have a primary care provider to get one, making sure that there's communication between what they see, what their plan is, and a primary care provider, and making sure that, in fact, that primary care provider provides the care and that you actually get transportation and be seen in that clinic. That is the work that this clinic does.
You can't keep doing things in the same way and expect a different result. So this is the beginning of how we do things in a different way, how we deal with, in an interdisciplinary way, those critical times of transitions of care from hospital to community, and reach people exactly where they are with the things that they need to get to fill those gaps in those social determinants, those critical things like nutrition and transportation and the comforts of life, and making sure that they have communications with their providers and that there's a team supporting them. This is exactly the right prescription for how we improve the health of this state and of the country. So I thank you all for what you're doing, and I look forward to working collaboratively with you now and in the years to come.
The needs of this highly diverse, under-resourced jurisdiction is something that we think a lot about at the Community Health Resource Commission. When Dr. Perman and his team put together this project, which is one of 77 in last year's RFP, the very executive summary just jumped off the page. It clicked all the right boxes: innovative, sustainable, replicable. And so we're very happy to support this program that will serve many, many vulnerable populations here in Prince George's County, and hopefully will help lay a vision for the rest of the state.